Good morning, I'm Inspector Michael Brown. I'm the Mental Health Coordinator for the College of Policing and the National Police Chiefs Council. This is just a short video for ICVs to cover the changes that are going to come forward in a couple of months to the Mental Health Act 1983. The Policing and Crime Act 2017 amends the Mental Health Act in terms of police powers and the use of police custody as a place of safety. And this is just to give ICVs a sense of what things might look like once the changes have taken effect. So first of all, police custody as a place of safety is going to be more or less phased out or ruled out. In the future, once the law has changed, you will only be able to use police custody as a place of safety under the Act if the person who is detained is exhibiting behaviour which poses a serious risk of injury or death either to themselves or to another, and in circumstances where no NHS place of safety in the force area could reasonably be expected to handle that person's risk. Finally, if police custody is going to be used, it has to be authorised by a police officer not below the rank of inspector. So here are a set of safeguards that potentially mitigate against the likelihood that frontline officers can remove somebody to police custody in circumstances where their medical welfare might not yet have been fully assured before we put them in a small environment where there is limited healthcare cover. So upon arrival in police custody, two factors then have to be borne in mind. Regulations under the Mental Health Act are going to insist that the police station we use is one which, wherever practicable, has a constant or regular healthcare presence throughout that person's period of detention. And secondly, whether there's a constant healthcare presence or not, there absolutely must be an authority to do a health check by a healthcare professional every 30 minutes. So naturally, some police custody areas in the UK are going to be able to do this because they have 24/7 nursing support, for example, but other, perhaps smaller, perhaps more rural custody blocks in isolated areas may not have constant healthcare cover and may not be able to ensure a 30-minute healthcare check. So this will have to be borne in mind when you inspect custody areas in terms of who you find detained. When you get there, it's going to look a bit different. You are going to find that in addition to having police officers looking after the health and welfare of the person, perhaps doing a constant watch at the cell door or perhaps monitoring the person via a camera, you're also going to find the healthcare professionals doing more frequent checks, and that might look very medical in nature depending on the background of the person or what the risk is. It could include blood pressure, temperature, heart rate and other medical tests. It might though on occasion be more of a visual inspection, especially if someone's been there for a short while and those tests were done earlier. But in terms of how that then comes to an end, there are two things to be borne in mind. The original grounds for using custody have to be around the risk that the person poses to themselves or others, and there has to be a certain standard of healthcare supervision whilst they're there. So if the original reason for bringing someone into custody has been removed, for example if the risk reduces and their behaviour stabilises a touch, then the person must be transferred from the police station to another place of safety in a healthcare building ideally. And if the capacity of the police service or that particular custody area to provide the healthcare checks diminishes, then also the person should be transferred from police custody. Now, everything I've just said there is specifically with connection just to adults, and in this context that means anybody who's reached the age of 18 or over. If a 17-year-old nearing their 18th birthday is detained by the police, the regulations and the amendments to the Mental Health Act state clearly they cannot ever be detained in a police station, and you should note that's a ban on the use of police stations, not just a ban on the use of custody. So to summarise that, serious risk, unable to handle in the NHS, authorised by an inspector, and only where there can be a 30-minute check of somebody who's in custody. And those are the kind of things you should be looking for when you're doing your inspection visits to custody, and hopefully finding that if there is anybody there, which should be a very rare event, their health and welfare is being prioritised over everything else.